Hi, this is the Ask Dr. Tommy show. This is Tracy. I'm the clinic coordinator and nurse at Echelon-Health. Today I have Dr. Anahita Azharian with Magnolia Plastic Surgery Center. Thank you for joining us.
Thank you for having me.
And we also have Dr. Tommy here too.
Thank you for joining us. I'm engineering today.
Yes, so Dr. Anahita Azharian was here about a month ago, but we're going to recap about where she went to school, where she grew up, before we begin talking about facelifts, Botox, and fillers.
I grew up in Tampa Bay area. I went to Gaither and USF. I did my medical training down in Fort Lauderdale, and I did my surgical and plastic surgery training in Philadelphia. Since then, I worked in New York City, and then I decided to move back to Tampa.
All right, how long have you been back in Tampa?
I came back in 2013, and I was in the process of setting up my own practice, and we opened up in end of 2014.
Okay, good. So last month we talked about breast augmentation, liposuction. What else we talk about? Tummy tucks. So today we're going to talk about Botox, fillers. I don't really quite know the difference between the two, and facelifts. So with Botox, let's talk about that first. What is the chemical that is in Botox?
Botox is actually botulinum toxin, botulinum toxin A. All it does is that it prevents your muscles from moving. So the areas of the face that we put it in is usually the forehead, the glabella, which is the 11 lines you get between your eyebrows, and the crow's feet. You weaken these muscles so they can't keep making the same expression over and over, which what produces the lines in your forehead and the crow's feet and makes you look angry. Fillers, on the other hand, they fill in lines. So the parenthesis lines around the mouth, the corners of the mouth as we age, it kind of droops downward. There are different consistency of fillers, different types of fillers. You fill in cheeks to give it more volume and give it more youthful look.
Is Restylane a filler?
Restylane is a filler. There are different types of fillers. They're hyaluronic acid, most of them, that we like to use. So if it's something, they're not permanent. They usually last about 6 months, 6 to 9 months, or sometimes up to a year. And there are some that last up to 2 years, depending on which one you use. So they do require maintenance, but it's excellent because first, you get to see if you like it or not. And second, if you do, you can come back and do it. If not, it goes away on its own. It's not harmful. It's something that when it dissolves, your body absorbs it. It exists in your body anyway.
So with Botox, how often can you do it?
Botox, usually every 3 to 4 months. You have to do it. We recommend to patients that. What are you saying?
Talk toward Tracy, so then you're talking perfect like that.
Okay.
Oh my God, I don't understand what this is.
You should be jumping up and down,
There,
right?
you perfect
Waving
like
his
that.
hands.
So you guys are talking to each other with a mic in the
So
middle.
basically, what did you ask me?
Oh yeah, Botox. How often can you do Botox?
Every 3 to 4 months you do Botox. So if it's a man, usually they have stronger muscles. It may wear off a little sooner, or it's your very first time doing it, or if you have very deep lines because you've been making the same expressions over and over for many years, it may wear off a little bit sooner. But so our recommendation is usually if you see if things are starting to wear off, come in for a treatment, because when you are on a scheduled treatment, then you're not starting from 0.0 again. And each time it may last a little bit longer, but usually about 3 to 4 months.
And let's say someone gets them right through. You said this is called the
Glabella.
glabella. How many cc's would a person get right through here?
We go usually by units. A lot of places, they price them differently, but we go by units. The recommendation is that you put 20 units there, so we always go by the recommendation and preparation that the company recommends for the best results.
All right, you obviously see more women than men.
Usually more women, but nowadays men are very much paying attention to their appearance, so our male population is actually increasing. It's an in-office procedure. It takes not even 10 minutes to do it. There's really no downtime. Obviously, there's always a potential for bruising or whatnot, but when you leave there, you look like you have little mosquito bites, which within an hour it goes away. No one ever knows you did anything.
Okay.
What are some of the side effects potentially of Botox?
Side effects, there's two things. One is that nowadays with Groupon and a lot of things that you see, or a lot of people, including non-plastic surgeons, are doing Botox, you have to make sure it's FDA approved, because there's a lot of third-party companies that do sell Botox at a cheaper price, and that's why when people come to our office, they're like, oh, I can get it for X amount of dollars. That's really not purchase directly from the companies, and that's why they're able to do. You don't know what other preservatives are in there if you ever have a reaction to it. It is a toxin, so there's always a potential for reaction, but it's extremely low if it's done properly. The other thing is that because it actually prevents the movement of the muscle, if they put it too low or not correctly, you can always risk dropping an eyebrow or kind of looking a little bit off. But the great thing about it is that it goes away on its own.
Well, I worked with a neurologist for many years, and we used to, she would inject the MS patients. I know you're cosmetic, but have you done that before?
We can do it for TMJ. It's an off-label use, but I have done it, and also it's approved for migraine. So a lot of neurologists do it, but it's something that can be done. A lot of urologists also use it. For a lot of urologists also use it for some of the issues. So it has multiple indications to use. Some are still not fully approved, but we do have the capability as physicians to kind of use it that way.
For a migraine, where would you inject?
For migraine, it's along the forehead, back of the neck. There are various points of tension that you injected to relieve that tension. You have to have certain criteria to be able to qualify for that. But a lot of patients get relief from it. Also for TMJ, a lot of patients, they opt to do that instead of surgery, and they get quite a bit of relief from it. And after a few treatments, some patients have actually found out that their TMJ has improved to a point that it doesn't bother them as much.
Okay. All right, we're going to take a break. We'll be back in just a moment.
All right.
I thought that's what you were saying,
What
Greg.
is that?
Break.
I know, it's like he's thinking, I'm like, oh, okay. He's
Yeah,
saying
because
break.
we're at like 5 minutes. I like to break then. So we want to talk about facelifts?
Well, we'll talk more about fillers.
Okay. Sounds good. And then facelifts.
Yeah.
Bring it up.
All right. Okay, so we're back with Dr. Anahita Azharian and Dr. Tommy. Let's talk a little bit more about fillers. Tell me when you would do a filler versus Botox, because I think I'm still confused a little bit about the two.
So the areas that you want the muscle not to move, and it's okay for it not to move, like forehead, crow's feet, the 11 lines between the eyebrows, you use Botox. It prevents the muscles from moving. The areas that you obviously want movement, like around your mouth, because you need to speak, eat, drink, you put fillers in to fill in those lines. So you never put Botox around your mouth, because then...
Oh, you don't?
No.
I have this
then it
little
will-
tiny line right here. Can you see it?
Yeah.
So I would do a filler.
You will do a filler, yes,
Oh.
because then otherwise when you drink, everything's going to come out.
Oh, okay. good to
Basically,
know.
Botox paralyzes.
Okay.
You see some of these movie stars, they have the face that looks like John Kerry, for instance, our esteemed Secretary of State. He has this face that looks like it doesn't move at all, like he has a neurologic disorder. Can you do Botox so much that eventually your muscles are done, basically?
No, they're never done, but I think that they actually do a lot of other things along with it. Some people like a little bit more movement than others. Some people like the frozen look, so that all depends on how much product you put in.
But when you see these movie stars that have this face that looks like it doesn't move,
It's
that's reversible.
It's a really tight facelift, probably.
Yeah. Oh, okay, a facelift maybe.
Oh, gotcha. Okay.
Yeah, it's a very tight facelift. So with everything, you want to look natural. You don't want to look, I mean, it's impossible to make a 70-year-old look like they're 20. So you want to improve what you have rather than look completely odd that people are staring at you, not for a good reason, but for a bad reason.
Tell us
Excuse me.
about facelifts. Facelifts are, people think of cosmetic surgery or plastic surgery. That's probably the top of mind that they have is a facelift. It sounds like this huge dramatic surgery, but it's actually, you're just kind of fine-tuning the facial anatomy. Really, it's not that dramatic, is it?
Yeah, so traditionally facelifts that you see with the older movie stars, the idea was just to pull the skin really tight, and the incisions are extensive. The recovery is not that bad. Usually within 2 weeks, most people are presentable to go to be in public. As with any surgery, it takes about 6 months or so for everything to settle in, but 2 weeks, they're pretty good to go. It's usually done under general anesthesia. In some older patients that have a lot of health issues, we are able to do it under local anesthesia with, some sedation. Yeah. But the idea of just pulling the skin so tight that you can't even move anymore, it's an old-fashioned idea. So we do the facelift, but now what we're realizing is that as we get older, we lose volume. And that's where all the fillers and fat grafting and things like that come in. So in conjunction with the facelift, you also want to fill in volume. Because if you look at your pictures from 10, 20 years ago, you notice that you're losing volume in your face and everything is going down. So you want to address both components.
Now, when you do tell us how you would do a facelift. Do you really cut around the outside of the face?
It depends on what they need. If it's a mini facelift, it's usually behind it. It includes the neck as well. It goes all the way behind the ear.
A mini facelift includes the neck? Or no?
If they want a neck lift, but usually you have to extend it to a little bit behind the ear. If it's a full neck lift, it goes all the way to the back of hairline. In women, it's easy to hide it because usually we have long hair. Men, you have to be a little bit more careful with that. If it's a full facelift, this incision can extend anywhere to the side of the ear all the way up to where the sideburns are or by the temple area. A forehead lift is the one that most people think about, that it's across the top of the head. And that's to give a brow lift, which addresses a different component than the rest of the face.
What type of person would be the best candidate for a facelift? I mean, it's a very broad thing to say, but if someone's at home like, maybe I should get a facelift, what are the things? Is it when your face is kind of drooping? And
I mean, they have to have enough skin laxity to be pulled. If somebody is really overweight, they're not a really good candidate for facelift. But if somebody has lost weight or aging process, it is, because you need to be able to pull that skin.
And sometimes with patients that have lost a lot of weight, you see that extra skin through here.
Right. A lot of people, they
jawline.
have this jawline that it's an overhang because the gravity pulls is not necessarily down, it's at an angle. So if you look at everybody that's aging, the first spot they see is right here. So that you can get a little lift. But the most important thing is that for them to be to be a non-smoker.
okay, because the
healing
healing
purposes.
is very important.
The healing and that skin will not survive, and you end up turning something that's supposed to be pleasant and I mean, it's unnecessary, but it's something that's supposed to be good, you turn it into a complete mess.
Who are some famous people who've had facelifts that have had a dramatic change that you think is a good change?
Let's see. I mean, Joan Rivers had a lot of facelifts. Hers wasn't that bad. I mean, who else has had a facelift?
What about Kenny Rogers? Do you know who he is?
Yeah, I know.
He
who
looks
he
like
is.
he's had a
I didn't pay
facelift.
attention.
His eyes are really tight.
I haven't paid attention to him.
Clint Eastwood looks like he had a facelift, or at least he had his
Clint
eyes
Eastwood
done.
is not looking so good.
But
Well,
he
he
had
has
his,
Clint Eastwood.
He's
Who's the Rocky guy?
that's Sylvester
Stallone.
Stallone.
Sylvester
Oh,
Stallone.
yes, he does look. Well, he's aging. I don't know how old he is now.
But Clint Eastwood had his, he was very famous for having these hanging, kind of
Yeah.
over. So he had this actually, you could tell he had an eye lift or a blepharoplasty.
Yep.
And now he doesn't look as distinctive as he did, but he probably did it for a good reason. I mean,
I'm sure he couldn't see at some point.
Yeah.
Because, I mean, there's a fine line with the eyes. There's a fine line between becoming medically necessary and not being medically necessary.
Mm-hmm.
And there are actually people that, as they get older, the skin is so heavy that when they talk to you, they're constantly trying to
Yeah,
raise
that
their
could be
eyebrows
annoying.
so they can see. And that can become an issue when
That's
they're
ptosis, right?
driving. When they're driving or not. And it has different components you have to address. Sometimes it's a muscle issue. Sometimes it's a skin issue.
Now, if someone comes in and has a facelift, let's say they're 50 years old, they get a facelift. Would you do on someone that young, or is it generally
It's not
someone
an
older?
age thing. It's more of a candidate thing. So we would
Okay.
have to evaluate them and see if they meet the criteria to do it.
Okay.
These days, a lot of times with all the non-invasives like fillers and Botox, the aging process, people are able to push it back a little bit more.
All right. We're going to go ahead and take a break, and we'll be back in just a moment.
so move that mic down because I feel like Anahita's having to strain. So move it back towards the camera a little bit. Do that or something. Because I want you, when you talking, project like you're talking to that little cone. Both of you. Even if you're looking at each other, talk into that cone.
Okay.
Okay.
Well, what else do we have to talk
The
about?
cone is at my nose level.
You want to bring it down?
Mine too.
That's fine. If you should talk like that. That's perfect. If you talk right
Just
into
like
it,
this, Anahita.
not that close.
AKA Persian goddess.
No, not that close. Okay. I'm going to bring it back up, okay? And thank you for joining us today. This is the Ask Dr. Tommy Show, and I have Dr. Anahita Azharian and Tracy Hoyle as our host today. And we're talking about facelifts, Botox, fillers, and we're here with the Persian goddess of water. Is that right, Dr. Anahita?
That's what it is.
Yeah. So tell us, we talked about facelifts, we talked about fillers, we talked about Botox. Where does rhinoplasty fit in? Do you do that as well in conjunction with a facelift, or is that completely separate?
It's a completely separate thing. Usually facelift patients are older patients. Rhinoplasty patients are usually younger patients that either they don't like the size of their nose, or there's a hump there that they don't like, various reasons that they want to change it. There's always a possibility of having a breathing issue with it as well, which that's the septum that needs to be addressed, not just for aesthetics.
You know, the rhinoplasty that turned out really well is what's her name?
I think Salma Hayek had a rhinoplasty.
Salma Hayek did, and the younger
Nose. Not
the Dukes of Hazzards.
Penelope Cruz.
Penelope Cruz did. Oh, she
Her
had a
nose
very
looks
prominent nose. That's kind of her
different.
trademark.
But
She
I
did?
mean, I don't know, but I noticed her like on some of the later films, like in
Uh-huh.
the last several years, and I was like, her nose looks different.
Who was the one that was married to the Nick Lachey? It's Jessica Simpson.
Oh, Jessica Simpson.
Her sister, her little sister, had a face or a nose job. Looked
Nose
good.
job.
Can't remember her name.
Yeah, Salma Hayek did, and
I
I
can't remember
confused
her
her
name
with
either.
Penelope Cruz. I mean, it was never documented, but her nose looks different. If you go back in the really, really old movies and the more recent ones, it looks a little different.
She also had a breast augmentation.
I didn't pay attention to that.
Of
Yeah.
course, he paid attention.
You know what?
You know,
Yeah.
Jennifer Aniston supposedly had a nose job too.
Oh yeah, I don't know.
You know what though? As far as surgeries, we
We
always
know all
talk
about these celebrities.
in sports medicine. One of the good surgery, I say it's a good surgery because it's very effective. Is like a hip replacement
Mhm.
or a knee replacement. If done right in the right candidate, it's very effective surgery. But I think from a cosmetic standpoint, if you do a rhinoplasty on someone who quote needs it, they want a different looking nose. That's one of the most dramatic things I think is changing that nose, and it's
It
I guess
is.
because it's the center of the face.
It's very dramatic. I mean, that's why it makes it kind of important that if because it's aesthetic and because it's not medically necessary. When you replace a hip, it needed to be replaced. You need to set very really realistic expectations. You cannot bring a photo in and say, I want my nose to look like
Right.
that, because we're all different individuals. There's going to be some components. And I think, in my opinion, the best ones are the ones that refine what you have, because you want to keep some degree of individuality with it. You don't want to look like a cookie cutter.
Does anyone come in and have unrealistic expectations?
There are people that come in and bring photos in and they want to have this person's nose. And I mean, you're not that person. It's not going to happen.
What are some of the new things that are coming out in plastic surgery or cosmetics? Anything new?
There's a lot of non-invasive procedures that are coming out, a lot of machines.
What about these vampire facelifts? What is that about?
I mean, you're injecting plasma-rich platelets in, so it does have some value to it. There's also the
We do
idea
that in sports medicine for like cuff tears and things like that. So what do you use it for in cosmetics?
of just facial rejuvenation. Some
Does it
people
work?
some people do see a difference with it. Again, it all depends on your body's capacity, and one person may respond to it much better than the next person. So you have to take it with a grain of salt. It's not, let's say, like a breast augmentation that you put an implant in and every flat-chested person is going to have cleavage, or like a tummy tuck that every single person is going to have a flat stomach. So it is a little bit different because you are relying on your body's response.
Is this the same as the PRP that you're referring to? Oh, okay.
Yeah.
Yeah, PRP is a platelet-rich plasma. So you draw off the patient's own blood, then you spin it down, and then you draw off the remaining, well, the serum. I guess it's serum.
Then you
you
re-inject
can
it.
inject it. They use it
Okay.
for hair loss, all kinds of things.
Some of the stuff is not approved here, but I know overseas they take that, they mix it with some components, I think calcium and some other things, and they re-inject it, and it's supposed to be very effective. I know people that have done it, and it's been very effective. But unfortunately, things like that, we don't have access to it here because it's not approved yet.
The funny thing is you're saying hyaluronic acid is that what's in fillers. That's what Uflex is.
Right.
When we
Yeah.
inject the patient's knee, we inject them with hyaluronic acid.
It's just processed differently.
Yeah.
It's a different molecular weight of it, but that's exactly what it is. They're actually in Europe. They're using it for instead of the buttock augmentation that here we use fat. They're using that.
Do you remember the thing in the news? It's probably been 5 years now. There's a lady who was a doctor who was using industrial silicone, like from Lowe's.
Yeah.
And people were letting her do it, like in hotels.
It is a lot of people, unfortunately, price shop. I always tell everyone, if it's too cheap, then something's not
Right,
right.
go somewhere else.
And don't get your plastic surgery off Craigslist, maybe.
Or in
Or-
somebody's hotel room.
Right.
Yeah.
Yeah. It's very, obviously that's risky.
Well, thank you for coming in, Dr. Azharian.
You're very welcome.
Azharian. Thank you for coming in, Dr. Azharian.
Okay,
You're very welcome. It was great to be here.
And we look forward to, we're going to do some joint work together where we'll have patients come in and they'll meet with myself and Dr. Azharian. We'll go over some weight loss strategies and then be able to kind of help them understand where they're going to go, where they're starting at, and then where they can go with.
Yeah, I
their
think that would
weight
be a
loss.
great idea because it actually gives them a broad spectrum of, how to get there, how to maintain it, which is, at the end of the day, you're doing all this to feel good about yourself, but you also want to be healthy to be able to enjoy this for an extended period of time.
And do it safely.
Exactly. Very important.
And, we'll do it with Fit Club too. And then Tracy's in charge of Fit Club. So.
And you're going to come to Fit Club?
I
right,
am
next
definitely going to come to Fit Club. Absolutely.
Oh, yeah?
Yes.
Okay.
One of these days.
All right.
week? He doesn't seem like he thinks you're coming.
All
Right?
right. Well, thank
Has
you.
he seen me walk past and just wave at you guys?
That's
and get
what
in my
everybody
car?
You
does.
said you get winded bringing in saline down the hall.
What?
Mm.
Do you know how many
I
people
do.
walk by and they see us every Monday and Thursday? And when it was cold, they said, "Oh, we're going to come when it's hot."
Yeah.
And now that it's hot,
It's too hot.
it's too hot. We're going to come when it's cold. I'm like, we're never going to see you at Fit Club.
All right. Well, thank you for coming in, Dr. Azharian.
Thank you.
Thank you very much.
And until next time, this is the Ask Dr. Tommy show. And if you'd like to hear more Ask Dr. Tommy, go to iTunes. That's the easiest way. Also, that's the easiest way to get the new episodes. And you can also see us, obviously, on AskDrTommy.com. We also have a plethora of commentary there. We have a physicians tab to help physicians learn how to do direct care membership medicine. We also have a patients tab. So if you're a patient and you want to find out how to find a doctor who does membership medicine. And then we also have an Amazon store. We have all kinds of different things there. So check it out. It's AskDrTommy.com. And this is Ask Dr. Tommy show. And until next time, bye-bye.
Thank you for joining us today. For more show news and information, go to AskDrTommy.com and be sure to follow Dr. Tommy on Facebook at Echelon-Health and on Twitter at Tampa Direct Care. To learn more about Echelon-Health Concierge Medicine Practice, visit Echelon-Health online at tampadirectcare.com.